As COVID-19 continues to proliferate, a debate is rising over how useful medical facial masks are. Some recommend, even require masks for everyone. Others, however, including the U.S. Surgeon General and Italian Health Minister, disfavor wearing masks for members of the general public who are healthy. So why are there such opposite views? Which advice should people take? I'm joined online from Nanjing, East China, by Dr. Zhiwei from the Center for Public Health Research at the Medical School of Nanjing University. He's an expert in viral infection and immunity. And from Guangzhou, South China, by Donato Marrone, an Italian national who works as a counsel lawyer at the GWA law tax accounting firm. Gentlemen, welcome to The Point. So on the Chinese social media, videos of two Italian parliamentarians wearing masks went viral, actually. They were wearing masks and they were ridiculed by their colleagues. And Italian health minister said the measures to be taken against the coronavirus are decided by scientists and not by politics. It is not scientifically founded that everyone should go around with masks. I want to go to Dr. Wu first. How scientifically founded or unfounded it is for people to wear masks? I'm talking about healthy people.
Well, actually, it's a complex issue because for the viral infections, which can be airborne transmitted or transmitted by aerosols, the face mask definitely would work, would prevent new infections. But for the coronavirus, which we are experiencing right now, the bottom line is that we don't absolutely sure whether this virus is transmitted by aerosol or by airborne manner. So my advice is that to make sure that you are protected in a mass gathering and in a crowded area or enclosure space. Now I would wear a mask, but in open space maybe it's not necessary.
So you're not sure. So we are not sure, but to help to a certain degree, just in case it is helpful, you can do that, right? Let me go to Marrone. Why is such a deal at this moment in a European Parliament? And we're not just talking about Italy. We have also seen it coming out of Switzerland, for instance. If a parliamentarian wears a mask, they tend to be ridiculed or even excluded, not allowed to proceed with their usual business. Why is that? Marrone, do you hear me, Mr. Marrone?
Good evening, everybody. Basically, I believe that people and congressmen... Yeah, I can hear you. I can hear you well. I'm talking.
Yeah, go ahead, please.
Can you hear me? I can hear you very well. First, I believe that the Italian parliament, the other congressmen, believed that the government exaggerated the answer. So this alarm created panic into the Italian population. That's why they kind of mocked at the Italian congressman, Mr. Dall'Osso, who wore the mask. Okay.
Let's take a look at some of the Twitter information sent out by foreign health authorities. And I will ask Dr. Wu on these questions. For instance, first we hear French Minister of Health Olivier Véran, and this in French, of course, but basically he's saying health masks are useful if you had been in close contact with a patient, and especially for medical professionals. But he didn't say whether face masks are not useful for healthy people or not recommended for healthy people. He just said facial masks are useful for those who had been in close contact with a patient. And then we also have U.S. Surgeon General sending out this tweet. Let's take a look. He said that, seriously, people, stop buying masks. They are not effective in preventing general public from catching coronavirus, but if healthcare providers can't get them to care for sick patients, it puts them in our communities at risk. Dr. Wu, do you think they are making the right statements, correct statements?
No, actually, I disagree with them, because if the face masks are working for health professionals, then it should work for ordinary people as well. The bottom line is that whether you are in close contact with the infected people. That's actually very important because this is also very much, circumstance dependent. In a country like in China, and there are a lot of very high population, and all the transportations are very crowded. I mean, the other thing is that this coronavirus infection, actually, we know for sure that for some people who are not diagnostically positive, they do not show up symptoms, but they are still contagious. So from those aspects, actually, it's highly necessary to wear face masks in areas with you have a mass gathering, and also in public areas.
So is that why everybody, so long as they can get their hands on a mask, is wearing a mask in China?
I'm sorry?
So is that why everywhere, almost everybody who can get their hands on facial masks are wearing one in China? Have the Chinese people overreacted? Because according to the tweets that I was reading, clearly they think that it's overreaction for healthy people to wear face masks. But in China, everybody is wearing one at this moment.
Yeah, I actually sort of agree with that tweet that people do overreact in the sense that everybody wear face masks. Some actually, even in their cars, driving cars, they wear face masks as well. But I actually just agree with some of the points that, if you are alone, not in the mass gathering and in the crowd, you don't need to wear face masks. I mean, that's definitely,
okay.
Just as what I mentioned, that, it's actually circumstance dependent.
All right. Mr. Morone, again, let me ask you from a cultural and psychological perspective. I understand in European countries, for instance, in Italy, if you wear a mask and everybody else is not wearing a mask, it's almost like putting yourself under the situation of a stigma. Is that the situation? Is it still the case?
I wouldn't say that, even if it is possible, but I believe that the main question Italian people are asking themselves now is why us? I mean, why, for example, countries like Germany, England, Spain, or France are not as infected as we are? Were we so unlucky? Were we so good to find these cases, or were we so not good that the virus expanded throughout Italy? This is the main question. Why us? For example, let me give you an example. In 1968, there was the so-called Hong Kong flu, and it affected around 250 million people, with 1 million people dying for this. But it didn't cause the panic that this coronavirus is causing today. So there is a big perception into the population that we might exaggerating, overreacting here.
Well, does it help? I mean, of course, okay, people ask, why us, why you, why not them? But at the same time, do they not think that they should take aggressive measures before it gets out of control? Do they? Because in English you say, I'd better be safe than sorry, but it seems from some of the things that we're seeing, people just don't think that is necessary.
Take the Italian economy is basically made by small, medium-sized enterprises, okay? So, for example, a family owns a restaurant and is employing, let's say, 10 people, okay? In this situation, they have no clients. So basically, what do you do with these people? If you fire them, then how are you going to start your business over when the virus will be gone? And if you don't, how can you pay them if you do not have any revenues? So that is why people are now a little bit starting to think that these measures are now killing the economy and not only prevent public health.
Let's come back to the question about facial masks, and I want to ask Dr. Wu in Nanjing. So what should people do then? On the one hand, in big open spaces. You don't need facial masks, but on the other hand, facial masks can prove really helpful, especially in China's case. I believe it is considered one of the reasons why China was able to bring down the numbers so fast, so drastically. So what can countries do?
Well, actually, I think, face mask alone probably won't do a complete blocking of the viral transmission. What actually people need to do is that they have to be, aware of how the virus is transmitted and keep away from mass gathering and avoid a large group of people, for all sorts of activities. The other thing is that they need to wash hands very frequently. I mean, so far, we know for sure that this virus is transmitted by contact and also by coughing and sneezing droplets. Those are the thing we are absolutely sure. But for the airborne transmission, we are not. We don't have very solid scientific evidence. So this is basically a combination of common sense, how to avoid the contact of the virus.
But wearing a mask would help the situation or not? Because against droplets, clearly a mask would help. Against airborne or aerosolized virus, it wouldn't help. Again, Mr. Wu, given that you have enough stockage of masks.
Yeah, I would definitely advise people to wear face masks, such as when I get on the subway, you can see that in Nanjing, I mean, there are a lot of crowds, particularly in the rush hour, and you will hear some people sneezing and coughing. Imagine that you don't have a mask. That probably would cause more panic and, and overreaction. So if you wear a mask, you feel that you do have a layer of protection. Of course, you have to use mask in the correct way.
Well, some people are also saying, very briefly, some people are also saying the death rate is 1%. So they are taking it very lightheartedly. Dr. Wu, should they be relaxed about it, or should really as much be done as possible to contain it? Very
well,
fast.
actually, life is a precious thing. You don't want to take your risk and to run your life, against the virus. I mean, basically, those precautions measures do not really cost you much. And if you do, then you would prevent a lot of trouble for yourself and for other people too.
All right. Many thanks to Dr. Zhiwei joining us from Nanjing, and for Malo Marrone, Donato Malo Marrone joining us from southern China. And with that, we come to the end of this edition of The Point with me, Liu Xin. As always, you can follow me on Facebook and Twitter using the handle The Point with LX. Thanks for watching. You've got The Point.